Welcome to the Dr. Francavilla Show. I'm your host, Dr. Carolyn Francavilla, board-certified family physician and diplomate with the American Board of Obesity Medicine. I've been helping patients lose weight to treat and prevent medical problems for the last 10 years, and I'm taking what I've learned from them to you. In this podcast, you will learn the science behind why you struggle with your weight and what to do about it, tips for common challenges, work to fight bias about what a healthy weight really is, and improve your relationship with food and your body. Please remember that while I'm a doctor, I'm not your doctor. This podcast is meant to be informational in nature only, not medical advice. Please seek out care from your physician for your specific needs. Okay, let's get started.
Hello, and welcome to this week's episode of the Dr. Francavilla Show. Today, we are going to talk about this JAMA article about the secret shopper obesity management medication patient who went to a bunch of telehealth clinics to see what would happen and published a nice scientific study on that. We are going to talk about what weight and obesity care should actually look like and how to know if you are getting adequate care or not. And finally, call to action if you are someone taking these meds or interested, how to find someone who really can provide high quality care. And if you are someone who provides this care, to put yourself out there a bit more because there are patients who desperately need high quality care. And I think that's what this article highlighted in a very scientific way. So this JAMA article, at least in the circles I'm in, I have not seen a JAMA article get this much attention in I don't know how long. There was buzz everywhere about this. I think part of the reason this article got so much attention was it was easy to read. It was something we all understood. Sometimes when we read scientific articles and you try to understand the methods and the statistics, it is very complicated and they can be a little hard to dive into and really, truly understand. And this article was very simple and straightforward, and I think makes sense to anyone who reads it, whether or not you have a scientific background or not. So it was pretty accessible article. And then I think it also confirmed what many of us were pretty sure was going on, but it published it in the Journal of the American Medical Association in a very scientific way to say, hey, there's a lot of bad care going on, and this is what it looks like. So I think that's why it got so much attention. So we're going to talk about, some of the things they found in this secret shopper study. And then I'm going to give my perspective on what care should actually look like. And then again, how to find it. So this JAMA article came out July 6th, I believe, 2026. And what they did is they had a secret shopper who was actually a researcher engage with 49 different telehealth clinics that offered obesity management medications. And the person themselves was in Connecticut. So all the clinics had to serve Connecticut. So these are, probably mostly nationwide programs, and they just tracked a bunch of different things that should probably be happening in any obesity management program and like how often they happened in this program. So I'm just going to dive right into the data because they had it all nice and clear in the study. So of those clinics, 79.6% asked about weight loss goals. And they did say that all of the programs did start off with a survey, a form of some sort that you had to fill out, right? And so on that survey or in the process at some point, 79.6% of people were asked about their weight loss goals. So that was the majority of them. And 65% were asked about prior weight loss attempts. For history, 93.9% were asked about allergies, and other meds. And that might sound like, okay, 93.9. That means 6% of these programs didn't ask if the patient had had an allergic reaction to another medication or what medications they were on. These medications can interact with other meds if you've had an allergic reaction to one of them. Your prescriber should probably know that before prescribing you something similar. So kind of shocking that 6% actually didn't ask about allergies. I'm not sure I've ever stepped into any clinical situation where a patient hasn't been asked about allergies. Like, it's one of the number one key things that happens when you're actually seeing a doctor. So that was, I think, actually pretty shocking that, again, a few of these clinics didn't even ask that. And then in terms of other sort of general history, only 36.7% asked about metabolic parameters like blood pressure or blood work. So again, this is like a bit of some red flags for some of these programs that they are not really treating obesity as a disease, that they're really not providing, in my opinion, medical care if they are not doing these things. So when we try to get a health history for weight, number one, it's a medical condition. So the history should look like any other history we are gathering when you see a patient. So if you're listening to this, probably you've been to a hospital, an ER, an urgent care, seen a doctor a few times before in your life, right? And there's pretty standard questions you always get asked, right? So, what are those questions? Well, we want to know what medications you're on, what allergies you've had. We want to know your family history. We want to know your personal history. What health problems have you had? What medications are you currently on? We would want to know your social history. Do you smoke? Do you drink? How much? A little bit more about what your living situation is like, your mental health history. So that would be like standard history. And then we, want to know about the history for the condition that you are seeking care for. So again, this is like any condition, whether it's ankle pain, shoulder pain, headaches, that you would go through this process, and the person prescribing would be sort of expected to know this background information, right? So, for your weight, we do expect that people would get a history of what has happened with your weight over time, what has worked, what hasn't. Have you had bariatric surgery? What medications have you tried? What lifestyle interventions have you tried? And that's really, I think, important history to get so that an appropriate treatment plan can be customized to you. And one thing that's really, I think important in that space is finding out about disordered eating. And only 55.1% of these telehealth clinics in this JAMA secret shopper study asked about eating disorders. This is something that I've been a huge advocate for in my space when I teach on it to other clinicians from the beginning. A large amount of patients have a history of eating disorders or may have active eating disorders. So that may be binge eating disorder. Planning to do a podcast update on that. I did one a couple of years ago, but we'll do a new one soon. Anyway, so binge eating disorder, which actually only has one FDA approved medication for it, which is Vyvanse, and someone should be offered that if that's actually the disorder they have, as well as the appropriate psychiatric or psychologic therapy for that, right? So they should be diagnosed with that if that's part of what is going on with their weight. But also, patients often will have a history of bulimia or anorexia or other eating disorders. And that's going to be really important to know when you are treating someone for their weight, because that may be a triggering time for them as they lose weight, and they really may need someone to talk to. It doesn't mean that they can't take a GLP-1 or another obesity medication, but that's someone who maybe does need someone to talk to and shouldn't just be filling out forms online. And then sadly, I'm hearing more cases of patients who have active restrictive eating disorders, patients who clearly have anorexia, who are underweight, who are in an unsafe, dangerous place with their caloric intake, who are harming their bodies, and who are getting GLP-1s online through these clinics. And so, not even trying to screen for that in some of these telehealth programs, to me is a really big red flag that that's not a program that's providing actual medical care and isn't following, our guidelines for how these medications should be prescribed at this point in time. Okay, so, a little more than half of them didn't ask about eating disorder, but almost half of them, 44.9%, did ask if you wanted a customized med. So I personally walked through, and I'll say which one it was. It was hers, maybe 9 months, even maybe a year ago. I walked through their algorithm just to see what it was like, how long it would take me. I did my own secret shopping, and it took me 9 minutes to get through their entire algorithm. All the information I provided was truthful, except for my height and weight, because I wouldn't qualify for the medication. And there was no process to confirm my height or weight. But I was asked at least 8 times, maybe more, if I wanted a customized dose to prevent something. Do you want a customized dose to prevent nausea? And I'd say no. Do you want a customized dose for this, for that, for this? And it kept leading me along the way, asking if I wanted a customized dose. So I found that to be really frustrating. There was a lot of questions about customization and no question to actually confirm my diagnosis, right? So that's a problem. That shouldn't be happening. That's not medical care. Okay. You shouldn't be like leading your witness to what you want to sell them. And that's what's happening with some of these programs, right? So if they're asking you lots of questions about customization, that's because they want to funnel you into this pathway where you get a customized compounded medication and they have a legal justification for why they need to compound the medication, but they may have been leading you there. Okay, so what else did we see in the secret shopper study? Only 26% required a video visit and only 6% required a call. I do think that it could be possible that you could provide okay care by asynchronous telehealth. I know some docs who work for a company that does that, and I think that it's a pretty well designed program, and I think it is possible. I don't know that it's ideal for everything. I don't know that it's ideal for weight management, but I think it's possible. But I don't think it's ideal. And so, the fact that the majority of these programs, you never had to interact with the person prescribing your medicine, I don't think that's great. I want to know who's prescribing the medicine. I want to be able to talk to them, ask them questions, and potentially hold them accountable if there is a problem with the medication I get. And then, to my point of my experience with the one that I secret shopped a little while ago, only 22.4% of them requested a full body photo and only 4.1% requested a picture on the scale. So they were just going in most of these programs based on self-reported height and weight. And I can tell you from my clinical experience that even people who qualify for these meds and are well-intentioned are not accurately able to tell me their height and weight. Most people don't actually know their height when we measure them in clinic. They are off often by several inches. And most people don't know what their weight is. Many of my patients have given up using the scale. They don't have the scale, and we have to coach through that and sometimes weigh them without them seeing it. So I think that it's unlikely that that information is actually very accurate. And the other thing is, there's no process in these programs that are keeping people who really are not safe candidates, who, again, may have disordered eating, body image issues, who do not need these medications and are maybe not safe to take these medicines. There's no process to actually confirm the diagnosis, which I think is problematic because there is people who really do want to be on these meds who medically it doesn't make sense. The risk benefit is not there. And I think doing an appropriate evaluation for that is appropriate. So I think those were some of the concerning things that they saw in this study. And then, the final thing that caught my eye was that they found that 3 clinicians out of, the 49 telehealth clinics, right? 3 clinicians prescribed to this same patient by 2 or more websites. So, these are doctors, nurse practitioners, PAs, clinicians of some sort who are just sitting at their computer all day, just approving. And, to the point where they are not even recognizing that it's the same name. A computer program's probably involved. They may not even see the name of these people. And the person was getting multiple prescriptions from the same person, right? Possibly for different meds or tripling up on medications. So, that's really concerning too. So if you, are the one prescribing, like maybe you should make sure that you're not doing that, because that's probably a red flag that you're not really paying attention to what you're doing. Okay, so I think, those are all problems. And it, again, isn't saying that none of the telehealth is adequate, because it sounds like there probably were a few who are doing everything right. And I strongly believe in telehealth. I've been using telehealth since I think 2017 when it started to be covered in Colorado. Huge advocate. I like asynchronous care. I do a lot of asynchronous care for my established patients that I've met in person. But I don't think there's anything inherently wrong with those things, but they really need to be done correctly, right? So let's talk about what doing this correctly looks like. If you're new to my podcast, I have been practicing obesity medicine for I think almost 15 years now. And I've taught a lot of clinicians how to treat obesity through my platform, helpyourpatientsLoseWeight.com, as well as just speaking nationally at many conferences and helping other clinicians become really good at treating their patients' weight. And I did help publish an article through the Obesity Medicine Association a couple years ago through our Pillars Journal about comprehensive obesity care. And we just wanted to lay some ground rules for what good care looks like. At the time, 3 years ago that we published that article, our goal really was actually to set parameters for insurance companies, because we were at that point, of course, already seeing lots of challenges with insurance companies making up their own rules about how care should be implemented. And so we wanted to kind of level set what good care was for people prescribing, and also so insurance companies couldn't just make up their own rules that were often arbitrary and excessive, right? So, well, what does good care look like? I think we talked about this a bit earlier in the podcast, but ultimately, our patients deserve a history, right? What's going on? A history like we would for any other medical condition. And then when we think specifically about weight, what's happened with their weight over time? Has this patient struggled since they were a young child? That is going to be a flag for potentially a genetic cause of obesity, which may qualify them for different medications that may be appropriate than our standard GLP-1 medications. We want to look for other things that have caused the obesity. Is there a medication that the patient's on that maybe could be substituted that has caused weight gain? Is there a underlying condition like Cushing's or hypothyroidism that could be the cause? That should be tested. And in this JAMA study, again, only 36% of people were asked about blood work or blood pressure. So without that information, you're going to miss these other causes that are really important to diagnose because they're going to cause other problems too. Other underlying causes, we see a lot of menopause that causes weight gain. We see ADHD, depression, sleep disorders that all contribute. And so without getting a history, you may not find these other things that are adding to the weight problem that could be fixed and also help people feel better as well. And then when we come up with an actual treatment plan for obesity, it is important that we factor in those underlying causes and come up with a comprehensive plan that makes sense for that patient. So, plans, in my opinion, they should always be offered all the options that exist, right? If we're just funneling people towards one or two medications that we're selling them, that's not real medical care. That's not real treatment. So we should be offering all the options and helping the patient decide what makes the most sense, right? So that may be lifestyle and diet. Maybe we do want to use meal replacement programs. I also have a podcast coming up for that. I don't think that's for another month or so, but that will be a great one. Have a wonderful guest lined up for meal replacements. Maybe a ketogenic diet is actually appropriate. Maybe we want to counsel on a specific lifestyle intervention that's going to supplement a medication, but offering lifestyle alone, so nutrition and exercise, does that make sense for the patient? Is there a specific plan that they may want to try? And then we want to make sure we've offered all the appropriate medications. I've done lots of podcasts on the different medication options, but we have phentermine, we have Qsymia, we have Contrave, we have multiple GLP-1s at this point in time. We have 4 that are approved for chronic weight management. So what is the appropriate medical intervention, or do we need combinations? And then finally, surgery. A lot of patients may be best served by surgery. I do have a couple podcasts where we've dived into that, including the one last week. And surgery may make sense, and that should be offered as an option. And then we help the patient select what makes the most sense, right? But simply directing them to a medication that we or the company we work for is making money off of, it really is not appropriate medical care. And then we also want to make sure we're not missing something else that's going on. Again, screening for eating disorders is part of our recommendations for treating obesity. And so it's really important that that is being done as well, and that we're not missing the opportunity to intervene or just appropriately counsel someone who has that history as they start a medication. Okay, so why is this important? Number one, it's important we're not missing something else. So we want to make sure, again, that we're not missing something fixable like hypothyroidism or Cushing's, and that we're not missing other things that are going on that are often coexisting with obesity. Type 2 diabetes. If you have not had blood work recently, you may actually have type 2 diabetes. Like, I think 1 in 7 Americans has it. And if you have obesity, you're at a higher rate to have type 2 diabetes. If you haven't had blood work in 6-12 months, how do we know that's not going on? How do we know we're not missing all the things we should be doing for someone with type 2 diabetes if we don't have that blood work? Sleep apnea. Again, you may be a great candidate for a medication, but there's more treatment that you deserve. Menopause, again, more treatment that you deserve. ADHD, depression, alcoholism, eating disorders, these all deserve appropriate treatment plans beyond just a prescription for a compounded GLP-1, right? So it's just not very thorough. And I think that you deserve more, right? If you're just clicking to get one of these meds online, we might be missing something. Also, we I think are unlikely to see the best results for people when they don't have an understanding of what's going on, when they don't have something that's actually customized based on their history, not just them clicking they want something customized. And so in my clinic, we have just seen phenomenal results on these medications because we do a lot of nutrition counseling and we use combinations of medications and we treat underlying causes. And so as a result, we often, have really amazing results. It's very rare, though we do see some people who don't respond to treatment interventions, but we really have wonderful results because of this thorough care. And this is what I hear from all my colleagues as well, who really go through the time and go through the process, is that they just see above and beyond results. So you may think you're saving money or time by just clicking online with one of these telehealth providers, but I think ultimately you're much more likely to get better results when you have more of a relationship with your clinician. And that could be by telehealth, but this is someone who's actually talking to you, right? Who got the history, who understands you, who confirms everything that's going on, who gets blood work, who makes sure you have a PCP. I think you're going to get better results. And I think we'll see more data that supports that over time too. And I really think you deserve to treat this like any other medical condition, right? You deserve good health care. One of the last things I wanted to talk about was that, and I don't know if I have the data on this from the article, but the majority also were not asked when they last saw a doctor. And before you start a medication for weight, I really would highly advise that you make an appointment with a primary care physician, a family physician, an internal medicine physician, someone who does primary care, who can make sure you're up to date on your screening tests, who can get that basic blood work, and who can make sure that going forward with this process makes sense. So if you have not had your blood pressure checked in years, if you have not had your blood work checked in years, you really should probably do those things before you go on a journey with these medications. So labs that we usually recommend for people who have excess weight are going to be a CBC, looking at your red blood cells and white blood cells, a comprehensive metabolic panel that's going to look at your kidney function, your liver function, your electrolytes, and a blood sugar. A TSH, that's a thyroid stimulating hormone, that's going to screen for hypothyroidism. And then lipids, so a cholesterol panel. So that's like really basic blood work. You may have gotten that or most of that out of physical in the last year. But if you haven't, you really should probably have that before you start one of these medications. And you may need additional labs above and beyond that, but those would be the basics. So, what should you do if you're thinking about starting a medicine or you realize maybe you haven't been getting this level of care that you deserve? Nobody's ever asked you these questions. Number one, I would ask with your PCP. I think everyone should have a PCP, and they may be either able to supplement the care you're getting by at least getting the blood works and the exam for you and letting you know if you qualify. They often will prescribe these meds. It's absolutely in the scope of any of your primary care clinicians to prescribe these, but don't be surprised if they do want you to have a separate appointment so that they can really evaluate all of this and do the thorough job that we've talked about today. Or they may be able to refer you to a clinician that they know who focuses on this. So I would highly recommend starting with your primary care if you are not getting this level of care. Another option, especially if you already have a primary care, would be to check out the American Board of Obesity Medicine. That's where diplomates like me who have gone through additional training and testing to become obesity medicine specialists, you can find physicians who've done that there. Or the Obesity Medicine Association, all of our members, which include physicians, nurse practitioners, PA, as well as other clinicians involved in the space, are listed as members on that site. So you can find someone else who, again, has gone above and beyond to get additional training in both of those places. And then finally, if you do select to use telehealth, which again, I'm not against, I've been a huge advocate for telehealth for a long time. I utilize it. I do all these things too in my clinic. I think you should meet your actual prescriber. If you don't know the person who's actually prescribing you the medication, I think that's questionable if it's actual medical care. Did they treat this like a medication at the end of the visit? Do you feel like this felt like if you've been to an urgent care or you've gone to your doctor and you've been prescribed a medicine, did it feel like that process? Or did it feel like you were sold something? I recently went to this shampoo company where they asked me, I don't know, 30 questions and customized a shampoo for me. I think it turned out pretty good. Sorry. Most of you are listening. You don't see me on YouTube fluffing my curls here. And it was a cool product, right? I liked it, and they asked me a lot of questions, and they customized it. But it was a product. It was not a medication, right? It was a product. If your experience getting a medication to treat your weight felt like that, you just answered a few questions and you got something in the mail, whether or not you liked what you got in the mail, I don't think you got medical care, okay? You should be able to communicate with the person who prescribed it to you. You should have had a thorough history, and you should have given a bunch of options of what was a good fit for you. You shouldn't have just been shipped something based on what that company could make money off of from you, okay? So that's my summary there. So you have some tips on how to move forward. And I'm going to put links to that JAMA article if you want to read the Secret Shopper article for yourself. I'll put a link to our Obesity Pillars article on what comprehensive care looks like. And until next week, take care.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com, to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.